Hi, good afternoon. Today we will be rationalizing your oncology nursing exam as part of your module 1. Number 1. During history taking, a client admitted with newly diagnosed Hodgkin's disease. Which of the following would the nurse expect client to report? So, keyword client is newly diagnosed. So, most probably it's new. Okay. And what will be your most expectation to be able to assess? So, basically, manifestation of Hodgkin's early in the disease. So, weight gain, eliminate because it's not a sign of cancer. Severe lymph node pain, remember that Hodgkin is commonly painless. It is commonly painless. Eliminate C. So it's either B or D. Answer, Boston. Night sweat. This is common for Hodgkin's. Headache, this is common, or this will only happen if there is metastasis. So the best answer here is Boston. Next, number 2. Client has developed oral mucositis as a result of radiation to the head and neck. Nurse should teach the client to incorporate which of the following measures in his or her daily home care routine. A. Oral hygiene should be performed in the morning and evening. B. A glass of wine per day will not pose any further harm, so let's eliminate B because wine, it's an alcohol, and remember that the client has oral mucositis. Alcohol will irritate further the inflamed part of the mouth. So eliminate B. C. High protein foods such as peanut butter. Remember that peanut butter is sticky. Therefore, it may stick on the part of the mouth where there is mucositis. So it will further aggravate the condition. So eliminate letter C. That leaves us to only two options, A or B. Answer here is Dallas. Why? Because in letter A it says oral hygiene performed in the morning and the evening only. Well, that's true for normal individual. But remember, the patient has oral mucositis, therefore oral hygiene should be more frequent. And the solution that is preferred to use is a combination of weak saline and water. Therefore, Dallas is the best answer. Next, number 3. Client with renal cancer is being treated preoperatively with radiation therapy. Nurse evaluate that the client has an understanding of the proper care of the skin over the treatment field if the client stage 2. So the specific issue here in this number 3 is that how would a nurse care the skin on which the radiation passes through? So that's the issue here. Is it A? Wash the ink marks? We all know you cannot do that because that is a guide of the technician where to continue um, giving the radiation. So the part of the skin where there is mark means it has already been radiated. B. Avoid exposure, possible. C. Apply perfume lotion of the skin. Of course, we know that's not possible. Aside from perfume, another contraindicator will be placing cream. What else? Lotion, that's contraindicated, and some deodorants. So we cannot place that over the skin. D. Wear tight clothing. This is also contraindicated. Therefore, the answer here is Boston. Next, number 4. The nurse is caring for a client admitted to the surgical unit following right modified radical mastectomy. Nurse include which of the following in the nursing plan of care for this client. So the issue here is, what will be your care as a nurse to a patient post radical mastectomy? Is it A, take the blood pressure in the right arm only? So we have already said that if an option has an absolute words, basically it's wrong. B, draw serum laboratory sample from the right arm only. Again, this is an absolute word, so let's eliminate that. So it's either C or D. Letter C, position the client supine with right arms elevated on a pillow. It is true that you need to elevate the affected arm, but position a patient after modified radical mastectomy is semi Fowler's. So let's eliminate C. Answer, Dallas. Check the right posterior axilla area when assessing the surgical dressing. This is true. Why? Because if there is bleeding after modified mastectomy, the by virtue of gravity, blood will be collected on the right posterior portion of the axilla because the patient is lying down. So by checking this, you can detect early bleeding. You can detect that. Okay? So the answer here is Dallas. Next, number 5. The nurse is caring for a client with multiple myeloma who is receiving IV hydration at 100 ml per hour, which finding indicates a positive response to the treatment plan. So issue here is you are trying to evaluate the effectiveness of your management to a patient who has multiple myeloma. So between the four, A, B, C, and D, which one will reflect a positive response? Is it A creatinine of 1.0 milligram per DL? So going back to the normal level of your creatinine, the normal level of creatinine is between 0.6 to 1.3. So it's normal. B, weight increases 1 kilogram. C, white blood cell count of 6,000. Or D, respirations of 18 breaths per minute. Now remember, a client who has a multiple myeloma is in an increased risk for renal damage. This is secondary to high calcium. Multiple myeloma will cause hypercalcemia, and also multiple myeloma will develop increased uric acid, and these two can form stones that can affect the kidney. So a normal creatinine indicates a normal kidney, which means the multiple myeloma is well managed. So the answer here is letter A. Next, number 6. A nurse provides discharge instruction to a client with testicular cancer who had testicular surgery. The nurse tells the client that in this situation, you are trying to educate the client after surgery. What are the do's and don'ts after testicular surgery? A. Avoid driving a car for at least 8 weeks. This will be eliminated because client can start driving after 1 week. After 1 week, the client may start to drive. Therefore, if after 1 week the client may start to drive, let's eliminate C. You don't need 6 months. That's too long. So the answer will be between B or D. B. Not be fitted for a prosthesis for at least 6 months. This option is also wrong and must be eliminated because prosthesis may be done during surgery. During surgery, the doctor may insert testicular prosthesis. This is to maintain the normal appearance of your testis. Okay, so the answer here is Dallas because D indicates possible infection. Next, number 7. The home care nurse is assisting a client in managing cancer pain. To ensure that the client has adequate and safe pain control, nurse plan to. The issue here is, as a nurse, how would you ensure adequate and safe control of pain? Is it A, rely totally to prescription? This is an absolute words, eliminate A. B, keep a baseline level of pain so that the client does not become sedated. This is wrong because your goal in pain management is to totally remove the pain. Don't keep any pain no matter what the intensity is. Even if it's just a mild pain, you need to remove the pain, the entire feeling of pain. Okay? So eliminate B. In letter B, it says you will medicate the patient but only to a point wherein the pain is in the baseline. That's wrong. The pain should be totally be eliminated. C or D, the answer, Dallas. Why? Letter C is not safe because you're trying multiple medication modalities for pain, which may cause harm to the patient. Safe and adequate means starting low and gradually increasing the dose. This is the safe way to give analgesic. Next, number 8. The community health nurse provide an educational session regarding the risk factors for cervical cancer to women in the local community. The nurse determined that further teaching is needed if a woman attending the session identify which of the following as a risk factor for this type of cancer. So we're looking for something that is not a risk factor because what is being asked is further teaching, not a risk factor of cervical cancer. A, smoking. This is a risk factor. B, single sex partner. This is not this is not a risk factor. Therefore, B is the answer. Risk factor for your cervical cancer is multiple sex partner. Sex partner. B is the answer. All of these remaining options are risk. Next, number 9. A nursing instructor asks a student to identify the risk factors for and the methods of preventing prostate cancer. Which statement by the student indicates the need to review this information? In this situation, we are trying the question is trying to assess your knowledge about risk factor and the ways to prevent your prostate cancer. So you should be knowledgeable about this for you to be able to get the answer. A, smoking. Yes, this is a risk factor. For almost all cancer, smoking is a risk factor. That's why it's the king of the risk factors. So, and remember, we're looking for a need. So we're looking for something that is wrong. So eliminate A, because this is right. A high-fat diet will assist in preventing this type of cancer. Okay, again, we're looking for that something that is negative. A is positive. B is negative. Therefore, it's the answer. Because a high-fat diet is a risk factor. It's not a preventive mechanism. It's a risk factor for prostate cancer. And so is STD. This is positive. And of course, age is a risk factor. B is the answer. Next, number 10. Nurse provide information to a client about performing a breast self-examination. Nurse determine that the client needs additional information if the client makes which statement? Select all that apply. In this situation, the question is trying to assess if you know the pointers to follow when doing a breast self exam, because you are a nurse and you will be the one to educate your client. So you should be aware of this. So let's go. Let's continue. Number one. Again, we're looking for a need for additional teaching. So we're looking for the negative ones. A. Number one, the BSE must be done monthly. This is true. So that's positive. Two, lumps in my armpit are normal. Hmm. Remember that most of your cancer or your breast cancer arises from the upper outer of your breast. And this area is located near your armpit. So this is negative. Okay? Not lump is not always normal. It may be a sign of cancer. 3. I can palpate my breast with soap, water while showering. This is true. That's positive. 4. I should perform the examination on the day that I start my period. This is negative. Remember that you should perform your breast self-exam after your mens. Number 5. When I squeeze my nipple, I should expect to note some discharge. This is negative. There should be no discharge on the nipple. 6. I should stand before a mirror and inspect each breast for anything unusual. This is positive. Therefore, the negatives are your 2, 4, and 5, which is letter C. Next, number 11. Nurse has completed discharge teaching with a client who has had surgery for lung cancer. Nurse determined that the client needs additional instruction about the elements of home management. If the client verbalized the need to, from this question, this item question is trying to assess your knowledge on the home care or the pointers to tell to the client when going home after surgery for lung cancer. A. Avoid exposure. And remember, we're trying to find need for further teaching. A. Avoid exposure to crowd. This is positive because if you have lung cancer, you are prone to infection. You need to avoid source of infection like crowded places. B. Deal with any increase in pain independently. In letter B, you're trying to say that you let the client decide, you let the client manage his or her own pain from cancer, which is negative, which make it the answer. You do not tell that to your client. Okay. Letter C, sit up and lean forward. This is true for greater lung expansion. D, call physician in case of increased temperature. This is also true. It may indicate developing complication. B is the answer. Next, number 12. The nurse is taking a history from a client who is suspected of having testicular cancer. Which of the following data will be most helpful for determining the client's risk factor for this type of cancer? So this type of question will try to assess your knowledge on the risk factor of testicular cancer. We all know that the most important risk factor for your testicular cancer is letter A, because this cancer are common between 15 to 34 years old, and this is common among Caucasian. Therefore, the answer is A. B, C, and D are not risk factor of testicular cancer. Next, 13. Nurses caring for a client with terminal cancer of the throat. Family approach the nurse and tell the nurse that they have spoken to the physician regarding taking their loved one home. Nurse plan to coordinate discharge planning. Which of the following services would most supportive to the client and the family? So let's analyze this situation. So the client has terminal cancer, which basically incurable. Therefore, the family decided to take to take the client home. And as a nurse, um, the question is trying to ask to determine your knowledge on how would you Or what kind of discharge teaching would you provide to this client? What specific organization would you try to coordinate to best support the client, which is stated here, most supportive? The answer here is letter A, hospice care. Hospice care is a type of care wherein it specializes on palliative palliative care. You see, palliative care, symptomatic. It does not cure the main disease, but it tries to cure, not actually cure, but to manage the sign and symptom, like pain. So it promotes comfort in the part of the client. And this will be the most supportive um, organization that the nurse can suggest to the family. A is the answer. Next, number 14. Home care nurses care for a client with acute cancer pain. The most appropriate assessment of the client's pain should include which of the following? A. Client's pain rating. B. Nurse impression. C. Verbal and nonverbal clues. Or D. Pain relief. The situation or the question is trying to determine if you're knowledgeable on how best or how, as a nurse, how would you best judge pain? And we all know that pain is subjective, therefore only the patient can describe the pain. Therefore the answer here is letter A, because pain is subjective. Next, 15. Client has terminal cancer and is using opioid analgesic for pain relief. Client is concerned about becoming addicted to the pain medication. The home care nurse allay the client's anxiety by. The issue here is, how would you allay the anxiety of your client who is thinking that opioid can be that patient has fear that he might be get addicted to opioid. So the answer here is Dallas. Why? This is a matter of fact. This is true because it rarely happens that a client will get addicted to an opioid. Matter of fact. A. You cannot advise A. You instruct the client to hold off. TSN? No. B. Of course not. You cannot give a lower dose. It will further increase pain. And C. Explain the client that the fear are justified but should be of no concern. No concern. That makes C wrong. D is the answer. Next. Number 16. Nurses care for a client with Hodgkin's disease who will be receiving radiation and chemotherapy. Which statement by the client indicates a positive coping mechanism to be used during this treatment? So all the options are about hair loss, but the only option indicates the proper adjustment or coping is Dallas. I have selected a wig even though I will miss my own hair. This is a indication of coping mechanism. Next, number 17. Client is admitted to a surgical unit with the diagnosis of cancer. Client is scheduled for surgery in the morning. The nurse enters the room and begins surgical preparation. Client states, I'm not having surgery. You must have the wrong person. My test results were negative. I'll be going home tomorrow. Nurse recognized that the ego defense mechanism that may be operating here is. So remember that the client is already scheduled for surgery. Therefore, the client signed the consent. Okay? So it's not psychosis because there's no hallucination and delusion. If it's not psychosis, of course, it's not delusion. So it's only between A or D. The answer here is letter A, denial. Next, before we go to the next, the answer here is A because based on this statement, the client can seem to accept the fact that he will go or she will go surgery. So the answer here is letter A. Next, number 18. 2 months after right mastectomy for breast cancer, client comes to the office for a follow-up appointment. After being diagnosed with cancer in the right breast, client was told that the risk for cancer in the left breast exists. When asked about her breast self-exam practice since the surgery, client replied, "I don't need to do that anymore." The nurse interpreted that this response may indicate, so the statement of the client indicates that he doesn't need to perform breast self-exam. It's a statement showing that client is in letter A, denial. Client cannot still accept he needs to perform BSE because there's a risk for cancer. A is the answer. That is denial. Next, number 19. When planning for the care of the client who is dying for cancer, one of the goals is that the client verbalize his or her acceptance of impending death, which statement indicates to the nurse that the goal has been reached. Answer, Boston. Because A, letter A, C, and D is a denial, client cannot accept that. Only B shows acceptance. Acceptance. B is the answer. The rest are denial. Next, number 20. Nurses care for a client with cancer who has a nursing diagnosis of disturbed body image related to alopecia. Nurse plan to teach the client about which of the following that is related to the nursing diagnosis. So which among the four is related to alopecia? Okay, eliminate A because letter A is about stomatitis. Eliminate B because there's no data to support B. So between C and D, the one that is or has a relationship to the diagnosis is letter C. Use of wigs. C is the answer. Next, number 21. Client with cancer is placed on permanent parenteral nutrition as a means of providing nutrition. Nurse includes psychosocial support when planning care for this client. So remember that the TPN is permanent and you're trying to provide psychosocial support. A. Death is imminent? Of course not. If you have TPN, it does not mean that is imminent. Why do you need to provide psychosocial support? Is it B? Parenteral nutrition requires disfiguring surgery. Does it? No, it does not. Eliminate B. Client will need to adjust to idea of living without eating by the usual route. Yes. D. Nausea and vomiting occur regularly with this type of treatment. Will prevent the client from participating in social activity. No, actually, we give TPN for nausea and vomiting because patient cannot take food orally. So the answer here is letter C. That's the best answer. Next, 22. Client with renal cell carcinoma of the left kidney scheduled for nephrectomy. Right kidney appears to be normal at this time. Client is anxious about whether dialysis will ultimately be a necessity. Nurse should provide which of the following pieces of information to the client. So remember, they will remove the left kidney, but the right kidney appears to be normal. Client's anxious if they will or if she will undergo dialysis after surgery. So let's try to find the answer. First, eliminate B because it says here, oh no, I'm sorry, do not eliminate B. Okay. First, eliminate letter C. Why? Because it says here, there is absolutely no chance of the client to need dialysis. This is false reassurance. So eliminate C. Next, eliminate D. There is no need for fluid restriction as long as the remaining kidney is normal. So it's between A or B. Answer, Boston. Because this is a matter of fact. Matter of fact. As long as one kidney is normal, it's enough. It supports life. Next, number 23. During the nursing assessment, client says, my doctor just told me that my cancer has spread and I have less than 6 months to live. Which of the following nursing response would be therapeutic? So we're looking for therapeutic response. A. I'm sorry, would you like to discuss with me some more? This might be therapeutic because it promotes verbalization. B. I'm sorry, there are no easy answers times like this. Are there? This is close ended. So eliminate B. C. I hope you'll focus on the fact that your doctor says you have 6 months to live and that you'll think of how you like to live. Eliminate, that is not therapeutic. D. I know it seems desperate, but there have been a lot of breakthrough. Some might come along in months. This is false reassurance. Therefore, eliminate D. A is the answer. Next, number 24. Nurses provided instruction to a client who is receiving external radiation therapy. Which statement by the client indicates a need for further instruction regarding self-care related to radiation therapy? So we're looking for a need for further instruction. So let's try to eliminate. Okay, eliminate B because this is not need for further instruction. Eliminate C because that is not need for further instruction. A or D? Answer, Dallas. Because she cannot apply pressure on the affected part. Most especially, there is no bleeding. There is no bleeding after radiation because this is external radiation. D is the answer. Next, number 25. Nurses provide instruction to a client regarding testicular self-exam. Which statement by the client indicates the client needs further instruction regarding TSE? So we're trying to find need for further instruction. Okay, the answer here is Boston because you need to check or perform TSE every month. You need to do it every month. B is the answer. Next, number 26. Nurse review the record of a client who is receiving external radiation therapy and notes that documentation of a skin finding noted as moist desquamation. Nurse expect to note which of the following on assessment of the client. First, let's eliminate rash and dermatitis because both of them are similar. Okay, sign and symptom of dermatitis is rash. So that leaves us only to C and D. And when you have dermatitis, again, it will be reddened. So eliminate C. Best answer, the last. Weeping of skin is manifested by moist desquamation. Moist desquamation indicates exposure of dermis. Next, Number 27. Client has had a laryngectomy for throat cancer and started oral intake. Nurse determined that client has tolerated the first stage of dietary advancement if client takes which of the following type of diet without aspiration or choking. So, client had laryngectomy. Remember, post-laryngectomy diet, we start your client with semi-solid food. If the patient can now tolerate semi-solid food, you can now give liquids. Because the fact that the client can tolerate semi-solid, client can also tolerate liquids. So the answer here is Dallas. A is inappropriate. So eliminate A. Next, 28. Nurse has explained the reason that the physician has chosen laser surgery to treat the client's cervical cancer. Which statement by the client indicates understanding of the explanation? So this time we're looking for understanding. Now remember that the management chosen here is laser. And when you're going to use laser, it's very important that the doctor has visibility, or the doctor can visualize area to be laser. And therefore the answer here is letter C. Doctor is able to see all the edges of my cancer clearly. Therefore the doctor can use laser. And laser is used local lang, locally, for localized cancer. Next, number 29. School nurse is planning to give a class on testicular self-examination at a local high school. Nurse plans to include which instruction on a written handout to be given to the students? A. Perform the self-examination every other month. Eliminate. It must be every month. B. Perform self-examination after a cold shower. Eliminate. It must be warm. C. Expect the self-examination to be slightly painful. Eliminate. The correct word is discomfort. Therefore, the answer here is thus. This is the right way of conducting your TSE. Next, 30. 32-year-old female client has a history of fibrocystic disorder of the breast. The nature determined, though the nurse determined that the client understands the nature of the disorder. If the client states that these symptoms are more likely to occur, first eliminate C and D, because spring and winter has nothing to do with your breast. Answer, Boston. Your fibrocystic disease symptom worsens before mens. Secondary to hormonal changes. Answer here is B. That's the last part of your module, oncology part. I hope you did learn and you got high on your exam. Thank you.